Good morning, dear colleagues. We are starting our working day, and our first topic is mission custodial sites in the anti-terrorist operation zone, problems of evacuation and public safety in Mariupol. And the first to speak will be Yuri Belousov, representative of the Parliamentary Plenipotentiary for Human Rights, Oleksandr Hatiyatullin, advocacy and legal support specialist of the All-Ukrainian Network of HIV-infected people, and Serhiy Pernykoza from the Ukrainian Monitoring of Human Rights Association. Good morning, dear colleagues. I am Yuri Belousov. I'm a representative of the Parliamentary Plenipotentiary for Human Rights representative. And just a couple of words about the general situation in Donetsk and Luhansk regions where custodial places of custody are concerned. Even as far back as in October last year, the representative for human rights addressed Mr. Yatsenyuk, the Prime Minister, trying to tell him that those who are in custody are most vulnerable in the zone of combat action because they cannot leave the zone on their own. They cannot evacuate themselves. So these people, and this is a great number of penitentiaries, not only traditional prisons and camps, and there are 27 such on the territory non-controlled by the Ukrainian authorities, almost 16,000 people, but also a great number of other institutions which the public usually does not perceive as places of custody, but I mean psychiatric hospitals, boarding schools, geriatric pensionary. And in fact, when the war in Donbass started in June, there were 77 such institutions in Donbass. And we asked the Prime Minister to do two simple things: either to evacuate those institutions to safe places in Ukraine or to provide for the continuous supply of food and other necessities. Last summer, the public and the representative were shocked by the fact that managers of departments and ministers do not understand their responsibility for those people who are still in custody there. The problem is that most of those institutions are subordinated to local bodies of power, either to Donetsk regional administration or to local authorities of lower level. So the ministers told us, please talk to regional administrations about this. And this, of course, does not correspond to the real situation. And I think that this was an attempt to shift responsibility from themselves for health and safety of those people. For instance, when I asked how much medicines was left for those people, I was told, just go there and see for yourself. This means that they do not feel responsible for those people at all. By the end of last year, we had, or even at the start of this year, we again appealed to the Prime Minister, and we reformulated our demand, our request. And you know, local or regional institutions are financed from regional budget, and if they are evacuated beyond the borders of those regions, then money is left in local budgets. So we asked the Prime Minister to consider redistributing the budgets. For instance, if a geriatric pensionary or kids boarding school or other institution is being evacuated to other regions, then you should have money to provide not only for feeding and keeping those people, but also for the staff that is responsible for them. And local bodies of power do not know where they can transport those people and where in other institutions like this in Dnipropetrovsk, Zaporizhzhia, or Donetsk regions there are vacant places. After all, such information was given to regional state administrations, and luckily a great number of people were evacuated from such institutions. But if we talk about, for instance, places of custody, like prisons, those problems were not solved at all. There was a decree by the presidents in November last year, and there was a special clause there that provided for the need to evacuate penitentiaries. However, over the entire period, only one jail was evacuated, solely due to the efforts by the Luhansk regional administration. Some figures, you know, so that you understand what we are talking about. And I'm not talking here about the 27 establishments that are still on uncontrolled territory, on the territory uncontrolled by Ukraine. We try to involve the Russian Federation's ombudsman to this problem, but they do not agree that they are involved in this situation. So we have some movement forward in this respect, and I hope that soon this problem will be solved. At the moment, at the touchline, there are several establishments, and on the territory controlled by Ukraine. My colleagues will tell you more about Mariupol, but there's also Dzerzhinsky prison, just 10 kilometers away from the confrontation line. And there's 589 people. A colony in Selidovi, 222. And the distance there is 19 kilometers. And for instance, multiple missile launchers can cover this, hit this in a wink of a knife. Also in Artemivsk, 14 kilometers away from the confrontation line with 700 inmates. These are the establishments that have to be evacuated as soon as possible, because we have a very sad case with Chernukhine jail in Luhansk region, which was in buffer zone, and there was time to evacuate people, but because the state did not do anything, many inmates died, and they had to leave the prison on their own. Some of them went to the so-called DNR, some to our site, and many of them died because of landmine explosions, and some of them were killed by the militants. At the moment, after many people have left, there were 370 inmates there, and then 83 came back to the prison, and 23 of them are in the investigator isolator, and we don't know where the other 200 went. We have the information that some of them are in the so-called LNR, but several dozens have died. And this is a result of negligence on the Ukrainian side. We don't want this to repeat. To round off my speech, I want to tell you that Alexander and Vadim and I will be present at the Public Council of Penitentiary Service, and we will state that the penitentiary service has to understand that measures should be taken immediately, not later. Alexander.
I'm Oleksandr Hatiyatullin. I'm the monitor of the National Preventive Mechanism. In April, our monitoring group visited Mariupol. The monitoring visits to ATO zone differ from regular monitoring visits during the peaceful life. We usually focus our attention on the security for people, on how the institution is prepared for evacuation. Our monitoring group visited the social institutions and the institutions of the Ministry of Public Health and Donetsk border guard unit and local courts. So what I saw personally, we looked at security measures, but in most cases we saw some specific things. The Donetsk border guard unit, the special facilities are on the territory which is not controlled by the government of Ukraine. The border guards stop people who violate the passport regime, and they fill in the protocol on administrative violation, but they do not report to the center of legal aid center. To our request to provide the list of the centers of primary legal aid, the head of this unit gave us the list, and there was one center mentioned which is located in Donetsk. Quite interesting situation. The monitoring of local courts observed the following problem that is related to personal security of judges. For example, in the court there are about 700 cases connected to separatism. And also they are considering now cases related to the servicemen who committed crimes. On the 6th of January, they were considering the case of two servicemen from the voluntary battalion. Just before that day, the servicemen from that battalion blocked the militia department, but on the first ground floor, the law enforcement bodies put a machine gun, a firing spot. And that court, the premises are on the ground floor of a residential house, which means that these are not just the people who are working in the court, but the residents of this building faced with threat. Also, I would like to mention our visit to the center which is a hospice at the Mariupolsky hospital. That was like a detective story. When we were looking for the entrance, the door was open and there was a man there. We found out later that that was a doctor. On the floor, there was quite a dirty person, and the person was lying on the floor, and the man who opened the door asked us, so why are you here? Who are you? Then he said, go to the central entrance, which was far away. We went there. Then they first did not want to let us in, and this doctor said, I have no key. We said, what do you mean you have no key? You just opened the door. But then we found out that at that hospice there were 7 patients, even though the doctor mentioned 11. The patients were in closed wards. They could not leave these rooms. The doors were, the windows and the doors were without handles. They could not air the rooms. And these elderly people, they were just left by themselves there. And then when we asked them, how do you wash yourselves and what do you do? And then they said that the nurse brings us some bucket with the water and we wash. But also we found out that the same facility is used for bringing those people who got drunk. They find such drunk people in the streets and then bring them there. And when they bring them to this place, this is the place where there's nothing, just the floor and the walls. And And that was basically that person who we saw when we tried to enter that so-called hospice. So in the result of monitoring of these institutions, we can make a conclusion that all these hospitals, the pension houses for veterans of war and labor, that in general they are supplied with all the medicines. One problem that the psychiatric hospital had was they were lacking the psychotropic medicines. Some of the charity funds were supplying some other medicines to them, but they had problem with this specific type of medicines. Also, the municipal services are trying to organize some shelters where possible. We visited them, we saw some chairs there, some mattresses, they refill the water reserves there periodically, they organize the training in civil defense so that disabled people and elderly people can go down to the shelter, but not everywhere they address the issue of those patients who cannot walk, like in the Mariupol pension house for veterans of war. They have now 100 patients like that, and the medical personnel are mostly women. And if there's shelling there, then it will be difficult to get them evacuated to shelters. And also, the situation with possible evacuation of such institutions is very complicated. Only one director of one institution knew where they will be evacuated and who will provide transportation. Other institutions, their managers could not answer the question, where will they be taken if they are evacuated? Thank you.
Good morning, I'm Serhiy Pernykoza from UMDPL Association. I'll tell you about my visit to Mariupol. We were in penitentiaries and also we visited the police precinct. A psychological situation in the city is very difficult, and you have to understand that people live in constant danger, and this of course puts pressure on people and also has bearing on attitude of those people who are in custody. When you come to the precinct and you see first of all the cage and then the submachine gun position, then this does not help your good attitude. However, people keep up and people work and they try to observe certain norms, though they do not succeed every time. And the first question at the precinct is whether the lawyers who work for free come there. The impression is that they do not come even though they are being summoned there, because they contact the detained people in a day or two after they've been detained, although they should be called immediately. Then we see some photographs which actually do not give us an idea how people work and live. Please understand that this is really scary. We, for instance, could not go into a toilet because you cannot go there without a gas mask. And the conditions of work are very bad. On the other hand, there are positive examples, like, for instance, in a women's penitentiary, which showed a good level of attitude towards people and administration as well. But we have to take into account that electric energy tariffs are a huge problem. When the government thought about subsidies for people, they did not take into account penitentiary establishments and custodial establishments, as the raising of the tariffs leads to trying to save money at the expense of not warming the premises enough. They used electric heaters to heat the places, but when the prices went up, they started to abandon this practice. And you know, when the highest temperature in daytime is 14 degrees Celsius, it is hard to live in such conditions, and this is dangerous for health. And while there is saving, and if you put in energy efficient lamp bulbs, they still do not reach the indicators that are there in the financial calculations. We have to do something urgently, because soon autumn will come and there will be no possibility to live there. Any questions? Why the authorities do not do anything? What is your point of view? Why don't they do anything? Well, I can't tell you that the authorities don't do anything. This would be an exaggeration. For instance, children's establishments were transported away. In Mariupol, there are several establishments where, for instance, children have their parents who do not allow children to be transported, or those parents live near Mariupol. The orphans were evacuated, and there is also a custodial center where there is 90 children who haven't been evacuated, and this is a very slow process, because our habit is we should do something when something happens, and they do not do this in advance. And of course you have to spend money and time for this, but this is a duty of the state to provide for the life and health of those people. And there is no responsibility on the part of officials for the lives of their citizens who are in such dire straits. Any other questions? Can you tell us how many people, to your mind, need evacuation in places of custody? You said that there are 77 establishments, but what's the aggregate number of people in Mariupol or in the entire zone of the anti-terrorist operation zone? There were 77 establishments in the entire anti-terrorist operation zone. In Mariupol, we have calculated about penitentiaries. I can tell you, in Mariupol proper, as I said, 87 plus 178 women inmates, 475 in investigation isolator. As far as children's establishments are concerned, 3 boarding schools that are still there. Partially this is a problem of legislation. When those kids have parents who are not deprived of their parents' rights, and they do not allow to evacuate kids. So if we talk about them, 3 establishments for children, and also a center which holds 56 children who don't have parents, and we do not need agreement from the parents, then they can be evacuated immediately, but the director of the center does not do this. We addressed the head of the regional administration to solve this matter. Also, 2 establishments for veterans of labor, almost 300 people, only in Mariupol. I think that maybe there are 3,500 people like this in the entire belt. If we talk about Donbass in general, a lot of places of custody, and I'm talking here about social establishments and health protection establishments. And there are also penitentiary establishments where you don't have to ask anyone's permission to evacuate people. Any other questions, colleagues?
A man-informed agency. Where are you taking children? And what conditions are created for them? Are they taken to the western Ukraine to show how people there live? It's, the east and west together. And then talking about Kamenets, you mentioned one children's detention facility near Mariupol in Kamenetsa. Are there any plans to evacuate the teenagers facility? There's no children facility institution in Kamenets. There is Mariupolsky penitentiary center, not for children. In Donetsk and Mariupol regions, there are no institutions for children. But at the same time, we still have children in Donetsk investigatory detention facility. UNICEF was there, international organizations that have access to the territory. We are trying somehow to make agreement with them, to negotiate with them, to provide access to these places. And also this is another delicate topic, whether we can negotiate with them, but from the humanitarian point of view, that is important, if that helps save lives of people, because these people who are there, they're practically hostages, and now we are talking to international organizations, to the UN monitoring mission, so that because they were on this territory, they talked to these so-called people's republics, and there are some attempts to discuss the issue of evacuation of inmates. Also, you asked about where children's institutions for children are evacuated. They evacuated in Kharkiv and Odessa. There were many which were taken to Odessa region, and then they came back. First, they were saying that children are to be taken to Odessa, then they were returned to Crimea, where it was the situation was very bad. But they are taken to different regions. Now the Ministry of Social Policy, they gave to two administrations, Lugansk and Donetsk, regional administrations, the list of all places. We have places to take everyone to. Children, adults, together with the personnel, talking about penitentiary institutions. In the last 5 years, we have a big decrease of number of people who stay at penitentiary institutions. There are places, they just need to take people there, but they're not doing it. Any other questions? In Russian and Western European mass media, they talk about the concentration camps in Ukraine. I know that Amnesty International is checking, inspecting, and they have not recognized that such camps exist in Ukraine. But does the government plan to file the cases against some even parliamentarians, like in Italy, some of the MPs were talking about that, and that definitely was something paid for by Russian side, but probably it's better to ask this question to the government. Thank God I'm not the representative of the government, I'm the representative of the ombudsman. If the government, if the Ministry of Foreign Affairs do not believe that these are the statements which do not harm the image of Ukraine, well, you should ask them. But talking about concentration camps, of course, that's not true, but there are some violations of human rights in our law enforcement institutions, bodies, when they especially conduct some anti-terrorist operations. Ukraine is not the first country that is faced with terrorism. There are countries that faced the problem of terrorism, and there are certain standards which define the limits of all that, like torturing, the situation when there is a threat to national security. Even in this case, you cannot torture people, and still we need to understand that we have to demonstrate higher standards than those people who are attacking Ukraine. We should be looking not at their standards but at European standards, and that of course affects the image of Ukraine worse than any ideas created by political forces. Thank you, colleagues.